Cancers. Answers. Put them together and you get Cancers, a Kimmel Cancer Center series intended to introduce the doctors, scientists, and nurses of Johns Hopkins who work every day in the battle against cancer. Cancers. Meet the experts.
Bone marrow, the spongy tissue inside our bones, is home to primitive cells that produce all the body's blood cells. Red cells that carry oxygen, white cells that fight infections, and platelets that clot the blood. Sometimes these blood-forming cells within bone marrow become diseased with cancer or other illnesses, and a bone marrow transplant is recommended. I'm Rick Jones, the director of the bone marrow transplant program here at the Kimmel Cancer Center at Johns Hopkins. A bone marrow transplant, sometimes also called a stem cell transplant, may be recommended to people with leukemia or lymphoma, broad terms for a variety of cancers of blood cells. It can also be used for non-cancerous diseases that affect the blood, like aplastic anemia and sickle cell anemia. Bone marrow transplant is not an easy procedure, but recent major advances, particularly in the use of half-matched family donors, have markedly improved the outlook for patients requiring this treatment. Bone marrow transplant uses strong medicines to wipe out diseased marrow in the patient's immune system so that we can inject new bone marrow cells from a healthy donor into the patient. If all goes as planned, the newly donated marrow grows healthy new bone marrow and blood cells. One of our biggest complications following a bone marrow transplant is called graft versus host disease, or GVHD. This is where the new transplanted immune system doesn't feel at home in the new body and can attack the patient. GVHD can be very dangerous to the transplant patient. That's why we used to always look for close family members, like brothers or sisters, become donors for these transplants. 1 in 4 siblings will be a very close match for markers on the body cells that are responsible for organ rejection and GVHD. In the past, bone marrow transplant was limited to the 25% of siblings who were fully matched to the patient. Transplants can also now be done with unrelated donors from international registries who happen by chance to be a full match. However, 30 to 50% of patients will not have a close match with a brother or sister, or from a registry, and some ethnic groups have only a very small chance of finding a match in a registry. Research from Johns Hopkins has shown that transplants between a patient and donor whose blood cells are only half matched can produce results similar to that seen with matched siblings. Each parent, most siblings, and all children of patients are half matches. These groundbreaking results have recently been confirmed in a national study. The results suggest that everyone, even those with few options and without a full match, is now eligible for a bone marrow transplant. This is a particularly big step forward for many minority populations whose chances are slim in finding matches from international donor banks.